South Africa will begin its COVID-19 vaccination program today, we're told, and that's after the arrival of those Johnson & Johnson vaccines yesterday. At least 17 sites in all 9 provinces have been used to inoculate, or will be used rather, to inoculate the first healthcare workers. The Johnson & Johnson vaccines were approved by the South African Health Products Regulatory Authority last week, and South Africa has received, we're told, about 80,000 of these doses, and they'll be receiving other doses in the coming weeks. A further 9 million jabs have also been procured by government. The J&J vaccine requires just 1 shot and can be stored in standard refrigerators, certainly a big advantage. For context on the way forward, let's bring in Professor Barry Schoub. He's the chair of the Ministerial Advisory Committee on Vaccines. Prof, thanks very much for your time. Welcome to the program. It almost feels, the phrase I used earlier this morning was the Johnson & Johnson vaccines almost arrived like a thief in the nighttime. And that was because many South Africans perhaps are waking up and finding this out for the first time. What can you tell us about where these vaccines are and when the first dose will be in someone's arm?
Yeah, and I wish I could say that. Unfortunately, as an advisory committee, we're not really involved directly in the rollout. So I know exactly, I think what you know is that, but I think it's very good news that the vaccine has arrived and that the implementation will be happening very soon, because clearly we need to inoculate our healthcare workers. They're really at the front line. They're the ones who kind of come into daily contact with cases. And of course, when we're in the middle of a wave, they get overwhelmed with numerous cases. So we really need to, I think it's incumbent on us to have them protected first and have them protected well before the winter season comes, when we are expecting perhaps a third wave to come.
Right. Are you as unclear as I am about which of the 1.2 million healthcare workers will receive these first 80,000 doses?
Well, I think really the kind of frontline healthcare workers will be selected. We've really kind of fractionated healthcare workers, those who are on the front line, those who really come into contact with patients, particularly obviously corona patients, but all patients, because one obviously doesn't know who has infected, who's not infected. And then those healthcare workers who are more remote from contact obviously will come second in the waiting line.
What is interesting and what might stand out for many people is that this rollout is actually part of an implementation study. Now, whenever there's a study, in my mind, it means there are questions we are still asking. What questions are we trying to answer with the Johnson & Johnson vaccine now that it's in the country?
Well, I think, with all vaccines, once they're rolled out, our prime question is safety. We need to establish, but of course, there has been numerous studies up to now to establish that it is a safe vaccine. But, the kind of safety monitoring carries on after it has been marketed. We call this post-marketing surveillance or phase 4 surveillance. So it continues, in fact, indefinitely, because we really do need to make sure that these vaccines are safe. And obviously efficacy comes into the reckoning as well. So again, there'll be a continuing monitoring of any breakthrough infections, in other words, infections which happen in people that have been vaccinated, I think those are the 2 kind of fundamental things that one looks for, safety and efficacy. And that carries on after marketing.
What does that mean for the recipients of these vaccines? It's a single dose jab. In my mind, you kind of get it and then you go on with your life. But if you actually part of the study, do we expect follow-up evaluations, for lack of a better term?
I think it'll be really kind of data monitoring. In other words, that they will register, and then if there are what you call adverse events, when you look at safety, for example, they'll be reported to a registry. And again, if there are breakthrough infections, that'll be reported. So I think it's really kind of monitoring. It's really data monitoring, essentially.
80,000 doesn't appear to be enough to affect the data in the country, though. But do we have any idea when an inoculation plan gets to a point where it should start having some kind of effect on things like the COVID-19 infection trajectory in any nation?
Yeah, Yanda, that's of course the kind of big question.
Yeah.
When do we reach herd immunity? And I think, look, we've got a big population. It's an enormous task to get everybody immunized. So I think that data that reassurance, should I say, of getting to herd immunity will really come, I guess, towards the end of the year, or at the end of the year. It's a big challenge to get all the way there.
Right. 40 million odd people is the target from government before the end of 2021. But
Right.
much has been said about all the vaccine candidates and their ability to treat mild and moderate and severe illness. But what do we know about the vaccines and their ability to actually prevent infection? And I'm asking this on the back of the mutations we're seeing and the fact that many experts are telling us that it is the fact that the virus is able to spread that gives it an opportunity to mutate. Is Johnson & Johnson able to at least help us address that aspect of our problems?
Well, the truth be told, there are really very few vaccines which cause what he calls sterilizing immunity. In other words, if somebody's been vaccinated, that they don't still carry the virus. And we do know that, in fact, from studies overseas, that people that have been vaccinated, one can still isolate virus, for example, from the nose and throat. But what we don't know is that well, first of all, that amount of virus is very low. And what we don't know is that is it capable of onward transmission? Our feeling is that probably not. And the reason being is that the amount of virus is quite low in people that have been already immunized. Obviously, time will tell, but we've been able to control measles and many other viral infections with vaccination, even though those vaccines don't elicit sterilizing immunity. So I think we're not too worried about it, even though you do isolate virus. But of course, we do caution people that have been vaccinated to still take precautions until we reach that level of herd immunity.
And that's where I was going. Hypothetically speaking, we get to herd immunity before the end of the year. That doesn't mean the virus is not in our midst. If the virus is still in our midst, it can still mutate, hypothetically speaking. Stay with me. And if it can still mutate, is there a possibility that there could be a mutation that emerges that is, call it smarter than the vaccines that we're using? Do you see where I'm going?
Absolutely. I think this is certainly something we need, which has to be taken into consideration. This particular virus does mutate, and it will mutate obviously to kind of escape vaccine-induced immunity. Remember, we are now in our first generation of vaccines. There will be second generations of vaccines, and I think the kind of more advanced developments of vaccines will need to take into account these mutations. So the kind of feeling now is that maybe we'll have to have regular vaccination as we do with influenza, maybe not as frequent as influenza vaccination, but certainly at a regular level to kind of keep up with the mutations. However, I think certainly if we do reach herd immunity, if we do vaccinate enough people rapidly enough say by the end of the year, we will dampen down that circulation of the virus. There will be new mutations. That's absolutely correct. You're absolutely spot on. And the more advanced vaccines will need to take into account these mutations. And there's a lot of research now, for example, looking at the parts of the virus which don't mutate but which are involved in immunity, and directing new vaccines against those particular sites on the virus.
Fascinating. Depending on how you see it, the fact that South Africa is actually the first in the world, if I'm not mistaken, to receive the Johnson & Johnson vaccines comes with certain pros and cons. Let's perhaps look on the brighter side of things. What is the advantage of being the first in the world to receive this particular candidate?
Well, you see, we are the first in the world also to have this particular variant, this 501YV2 variant, as our dominant variant. So in that sense, obviously, we're also pioneering. But look, it's a very good vaccine, and I think it's great that we can demonstrate, and I think we will demonstrate that it is quite effective against this particular variant. So we may be kind of showing the world that now we are experiencing the domination of a particular variant and having a vaccine which can deal with it. So I think that is particularly favorable news in a way.
Right. I wonder if it places us as an advantage in the world of science, so to speak. I mean, a lot of questions we'll be able to answer first, I imagine, because of the pioneering way in which we are going about with our inoculation plan. Does that come with any fringe benefits? The fact that there's just such an unexplored terrain in South Africa, and how many people will take an interest in how COVID-19 actually fares in this country. Could it place us in a position where we're able to make certain calls, so to speak?
Well, yeah, you see, I think we are actually very fortunate in the country. We've got a very strong scientific resource. I think having these very good scientific platforms in the country, they were able to pick up the variant at a very early stage. They were able to carry out clinical trials, which demonstrated that perhaps one vaccine wasn't so effective, other vaccines were effective. So I think having that scientific infrastructure in the country at quite a high level, at a very high level, in fact, does put us at an advantage to manage this epidemic and manage variants, for example, manage having vaccines and be able to assess vaccines and their efficacy against these variants. And I think this has got global implications, not only for our country, but for the world.
Fascinating insights. Of course, we could go on until we actually reach herd immunity, so I'm told to wrap up our interview. Thanks very much for your time. Really appreciate your coming onto the program.